presentation. He's got awesomeness in him. That's all I can say. Mine is definitely not anywhere near what his was, very last minute-ish. But a lot of similarities in our journey, I guess you could say, and the things that happened to us. Unlike him, he's a XX. I'm actually an XY. That was kind of funny because, I always tell everybody, I could commit the perfect murder. I leave my blood at the scene. They'd go arrest my brother. Or you could do the same thing. They go arrest your sister. So just a thought. Yeah. So this is myself and my husband and my son. So I can kind of get into a little bit, talking about chemotherapy and radiation and things it does to your body. My son is actually a surrogate baby because it does things to your body. Chemotherapy and radiation does things to you that really kind of hurts your chances in some realms, and that would be one realm. So this is us this summer in Tahoe. Just a little bit about me. I was born in 1971. I started at Long's Drugstore when I was in high school as a clerk up front in the store, and they needed some help in the pharmacy on the weekends. And so I decided to go back in the pharmacy and help on the weekends, and that's kind of where my interest was. When I was in high school, I had no interest in really anything. Whatever classes I could take to get me out of school earlier or, whatever. Didn't really have a lot of aspirations while I was in high school. I actually worked with Dr. DeGuire's husband in the pharmacy at Long's Drugs, along with two other pharmacists who were very good mentors and really pushed me into pharmacy. And, being working back there, and I could count by 5. I could do that. I could do that for a living. So, became a pharmacy technician in '93 when they grandfathered technicians in. So I didn't have to do any schooling. I just said, okay, sign the dotted line, and you're a technician. So I did that. And then that was probably, I was in school already to go to pharmacy school. I was taking prerequisites at a junior college. And much like Oscar, I was tired. I probably had joint aches, but didn't really realize it. I was working probably about 20 hours a week. I was taking 15 units, including chemistry, general chem, some biology and calculus, and some of those really dumb art classes that you have to take to go to pharmacy school. I really didn't know what. I didn't think anything of it. I was just tired because I was working a lot and going to school. So luckily enough for me, I got bit by a spider. Middle of the night, didn't know it, woke up the next day and had a big welt on my leg. Started scratching it, and when you have leukemia, your white blood cells don't work, so you can't fight infection. So the spider bite got infected. Kept scratching it, itched like crazy, and started festering and looking really ugly. And my boyfriend at the time, who is now my husband, told me, you need to go to the doctor. Well, I have a biology test today, and, got to work tonight, and whatever. And so he got me to go to Kaiser for a checkup on this spider bite. So luckily it was on my leg, so I had to gown up, go into the exam room, and I had a bruise on my knee and a couple on my hands, I think. And I said, oh, by the way, I've been bruising a little bit easier than normal. I, just kind of offhanded comment. And he said, oh, well, we can do a blood test if you want. You're probably just a little anemic. Oh, sure, let's do a blood test. That was on a Tuesday. Tuesday night, I'm at home, 9 o'clock at night, and the lab calls from Kaiser. Person says, what were you seen for today? I said, oh, I got bit by a spider. Okay, well, hold on a second. She comes back on the phone, talked to one of the doctors that was on that night, and they said, let's have you come back in tomorrow for another blood test. Your white blood cells were elevated. Okay. So Wednesday I went to biology class, took a test. Went back to Kaiser. By 2 o'clock that afternoon, I was in the ICU unit at Kaiser. They took me by ambulance so I was at a smaller facility, took me by ambulance without me knowing what was actually wrong. I was 22 at the time. Still lived at home, very, very young 22. Called my mom from the hospital in tears. Mom, they're taking me to Kaiser Martinez by ambulance. I don't know what's wrong. So they take me there. My boyfriend and my mom met me there. And they took me to a room, and the nurse walks into the room and says, "What are you doing in here? You're supposed to be in ICU." Still had no idea what was wrong with me. So the doctor came in. My husband and my mother swear he says that he was an oncologist. I didn't hear it. All I heard him say was, "What we're dealing with is treatable. What we're dealing with, you can get through. What we're dealing with," that's all I remember. And finally I stopped and I said, "What are we dealing with?" And he said, "You have leukemia." And me being in biology, we were actually in the blood portion of my biology class. So that day, I was taking a test on white blood cell counts. What is your white blood cell count supposed to be? Anybody know? Come on. Teachers hate it when you don't answer questions.
4,000 to 11,000.
Sure. When I went in on Tuesday, my white blood cell count was 210,000. When I went back the next day, my white blood cell count was 510,000. Much like Oscar, they said, "How did you walk in here?" They said they couldn't believe I was still standing. They couldn't believe I wasn't passed out somewhere, because when your white blood cell count is 510,000, your platelets and your red blood cells, which carry your oxygen, are nil. No room for them. The bad white blood cells push it out. So they were very shocked I was even standing, let alone going to school and working. So intrathecal treatment, just like Oscar was talking about. I had it that afternoon. My experience was a little quicker. I didn't have to go through the whole summer feeling bad. I was, it was very, very boom, boom. It was a very quick thing. I had ALL, just like Oscar, but I was an adult. I was 22 when I was diagnosed. I also had an abnormally high white blood cell count for having leukemia, for being first diagnosed. And I also had an abnormal abnormal T cell. So those three things in and of itself, my chances of survival without a bone marrow transplant were about 20%. So chemotherapy and radiation wouldn't have worked for me. So my first line of treatment was a bone marrow transplant. First, they needed to get me into remission, which they did with just straight chemotherapy. So I was basically in remission within about 2 weeks. And so we started, just like I said, open up a book. Okay, you have ALL. Oh, let's choose this one. This is your treatment. So my treatment was 5 rounds of chemotherapy within, I think it was about a year. So being that I was in remission so quick, after my 3rd round of chemotherapy, the doctors came to me and said, "Okay, you need a bone marrow transplant." They tested my brother, only sibling. He was a 6 out of 6 match. So there was, no guessing game there. Transplant was the only thing for me. They said, "Do you want to go to UCSF or do you want to go to Stanford for your transplant?" UCSF wanted me to complete my 5 rounds of chemotherapy. Stanford said, "She's in remission now, let's do it now." So I said, let's do it now. Who wants to go through 2 more rounds of chemotherapy if they don't have to? It's pretty nasty stuff. So